I'm Lisa Ryan, president of Yavapai College. It's Thursday, March 11th, and I hope you all are doing well. As we head into the spring break next week, I wanted to update you on the college's operations related to the COVID-19 pandemic, where we stand today, and what we're envisioning for the future. As you know, the number of positive cases and transmission rates have significantly decreased over the last 30 to 60 days. And last week, Governor Ducey relaxed restrictions on businesses and restaurants, allowing them to operate at 100% capacity while still adhering to mask and social distancing mandates. Governor Ducey also called for all K-12 schools to resume in-person learning when they get back from spring break. Although there was no specific information for higher education, the relaxing of these restrictions is a positive sign that health experts believe we're heading in the right direction. The executive leadership team and I agree that it's time to start bringing more classes, services, and activities back in person. On February 18th, we announced that Yavapai College would be moving forward to the yellow phase of its reentry plan when we return from spring break on Monday, March 22nd. And I am pleased to say we're still on track for this move. The yellow phase will bring more hybrid classes with in-person components to our schedule for the second 8 weeks of the spring semester in the areas of visual and performing arts, music, and physical education. It will also allow for more services to be offered in person as needed, such as our testing center, computer commons, recruitment and admission activity, among others. Earlier this week, the CDC updated its guidelines for vaccinated persons. The main change that affects the college is that those that have been fully vaccinated will not be required to quarantine if they've been identified as a close contact with an infected person. A fully vaccinated person is considered someone who is 2 weeks removed from receiving their second dose of the vaccine. Those who are not fully vaccinated will need to quarantine if they meet the criteria for close contact exposure. This change has been reflected in our COVID-19 operating manual. As some may be traveling over the spring break, we would like to remind you of CDC's out-of-state travel recommendations, which YC is following. Per the CDC, both vaccinated and unvaccinated out-of-state travelers should get a viral COVID test 3 to 5 days after travel and stay home and self-quarantine for a full 7 days. Even if you test negative, stay home and self-quarantine for the full 7 days following travel. If your test is positive, isolate yourself to protect others from getting infected. And if you don't get tested, stay home and self-quarantine for 10 days after travel. I know these guidelines for vaccinated people and travel may appear contradictory, but this is the latest guidelines that we have from the CDC. The difference appears to be that if you travel, vaccinated or not, you should quarantine. As the CDC makes adjustments, we will be sure to reflect them in our COVID operating manual. Despite the move to yellow, we will continue to err on the side of caution when making operational decisions moving forward. At this time, vaccinated and unvaccinated people are still required to follow YC safety protocols, which you should all know by now, but which include wellness checks through our Campus Clear app before coming to campus, staying home if you're experiencing symptoms or are awaiting a COVID-19 test result, self-reporting if you've tested positive for COVID-19. Face coverings are required for all employees, students, and visitors, except when outside with adequate social distance. Social distancing of at least 6 feet, practicing healthy personal hygiene, frequently washing our hands, not touching our mouth or eyes, and following sneeze and cough etiquette. Cleaning and sanitizing our workspaces, and well-oiled temperature checks are required for campus police, custodial staff, students and faculty in first responder programs, the Family Enrichment Center, and performing arts programs, coaches and athletes, residence hall students, and any staff whose position requires significant community interaction. These protocols have been the backbone of our mitigation strategy, and they have worked. In preparation for more in-person traffic, we have installed new fixtures in our buildings and workspaces to improve overall health. These include hand sanitizing stations, touchless door and bathroom fixtures, plexiglass barriers in common areas, and improved air filters and circulation, including ultraviolet filtration in our health buildings. Our athletic teams have been back on campus since January. They are living in the residence halls and adhering to strict rules while in the halls, at practice, and traveling for competition. I want to commend our athletic staff, our coaches, and our athletes for their dedication to following these rules and keeping everyone safe. COVID testing was conducted upon residence hall move-in addition to weekly surveillance testing of our athletes. Positive cases were isolated quickly, and our safety protocols proved to be effective in preventing further spread. And I'm pleased to announce that we have had 4 straight weeks with 0 positive tests. As we look to the future, the vaccine should become more available for all adults soon. If the positive cases and transmission rates continue to decline, I believe that Yavapai College will be in a position to move to further opening and a full return in the fall. Our fingers are crossed and we are hopeful that this will indeed happen. Next week, March 15th through 19th is spring break. It is a much-deserved break for all of our students, faculty, and staff. All college offices and services will be closed during this week, and we will return on March 22nd in our yellow phase for the second 8 weeks of the spring semester. Please use the week to refresh your minds and bodies and decompress from this fast-paced semester. I hope you all have a great break. Please stay safe and stay well.